My passion for mental health is because of my parents who suffered from depression, both of them. My passion for mental health is because of our daughter who was diagnosed with anxiety and depression and addiction issues just a couple of years ago. She's in recovery now and using all of her talents to help other young people, for which we are grateful, but recovery is a journey, it's not a destination. And when she was first diagnosed, I just want to say that it was really a tough time because she was in pain, she was in a lot of pain, and I had no idea where to turn for help. And here we are, a family with resources, a family that's connected to a lot of other people, but we had no idea really like where to begin. And there was no established series of steps. And then even when we started reaching out, we found like there was no measure, like, okay, this is somebody I can talk to, but how do I know this is gonna work? How do I know this is the kind of person that is really going to be able to steer her through the long haul? I really didn't know. We didn't know. And it made me wonder, well, what do other families do? Like, if here we are, we got health insurance, we got the coverage, we got the network, well, how do other families handle it? How does a family that doesn't speak English handle this? How does a family with all kinds of other barriers handle this kind of problem? So it made me even more sensitive to an issue that I had kind of grown up with, because in addition to my parents, I had friends who had challenges. I've been through so many experiences where people had very tough times, and still all the people around them would just whisper about it. They would whisper, if that, many times people wouldn't even talk about what was going on. And I just thought it was just such a curious thing that there could be so many people suffering, so many people going through similar kinds of experiences, but yet no one was talking about it. So as First Lady, I have a great platform, and I said, well, one of the things I want to do is just to talk about this. I want to talk about this. I want to hear what other people have to say. Once I decided I want to focus on this as my issue, we've started going around to all the boroughs, started going to the schools, started talking to providers, started talking and listening, of course, to people about how they experience the mental health system, which I shouldn't even call it a system because it's not a system. It's a series of services. Some of them are excellent, very excellent services, but it's fragmented. It's very hard to find what you need, where you live, or where you work, or where you go to school. We want to make it better. We are deeply invested in making it better. As Linda said, we've invested a lot of money in those services that we know work very well, but we know we don't have enough. We know we don't have enough of the right kind of providers. We know that some things like peer counseling, but we aren't training enough peer counselors. This is a people challenge, and we need people solutions. So that's why I'm glad all of you are out here tonight. Want to hear what you have to say, and I really look forward to your thoughts. We have been to Brooklyn, we have been to the Bronx, and let me just tell you just a little bit about what they've said. They've said, in too many communities, mental health resources are far and few between. Many of the programs that do exist are under-resourced and disconnected. Too many families go through hell trying to navigate the system. And service providers often feel alone and overburdened. So some of those things I've said already, some of those things I'm sure we're going to hear again tonight. But again, thank you for being here, and I look forward to everything you have to say. And we are deeply privileged to have with us tonight our Commissioner of Health, Dr. Mary Bassett.
Does this work? This works. Good evening.